Are you familiar with IV fluids? These are solutions that are administered directly into a vein to provide various benefits. Here are some key points to understand. IV fluids are primarily used to replenish fluids, and electrolytes provide hydration, support blood pressure, and deliver medications or nutrients. They play a crucial role in treating conditions like dehydration, shock, low blood pressure, electrolyte imbalances, and are commonly used in surgical patients or those experiencing severe vomiting or diarrhea. There are different types of IV fluids available. Let's take a look at some of them. Normal saline, 0% sodium chloride. This solution consists of sodium chloride present in water. It is used for mild dehydration, shock treatment, and even as a carrier for medications. Lactated Ringer's solution. This solution contains electrolytes like sodium, potassium, and calcium. It is often used in severe dehydration cases, shock treatment, and electrolyte imbalances. Trauma patients, burns victims, and individuals with severe vomiting or diarrhea can benefit from this solution. Dextrose solution, 5% or 10%. This solution contains glucose, which provides energy and hydration. It is commonly used in patients with low blood sugar, surgical patients, and as a maintenance fluid. Hartmann's solution and plasma-light solution. These solutions have similar compositions to lactated Ringer's solution and are used for severe dehydration, shock treatment, and electrolyte imbalances. Isotonic solution, consisting of sodium chloride, 9% and water. This solution helps maintain fluid balance and hydration. It is primarily used in patients with mild dehydration or as a maintenance fluid. Hypotonic solution, with a sodium chloride 0.45% and water composition. This solution is utilized to provide free water and hydration. It is particularly suitable for patients with hypernatremia or high sodium levels. The administration of IV fluids involves the insertion of an IV catheter into a vein, followed by the connection to an IV bag or bottle. The flow rate is regulated by a healthcare professional. While patients receive intravenous fluids, it is crucial for healthcare providers to monitor factors such as fluid intake and output, electrolyte levels, blood pressure, and the overall condition of the patient. Understanding the various types of IV fluids and their purposes can help in providing effective care and treatment